Hello everyone, my name is Delebah Yaidoo. I am here to present my DMP project. I did this project on bedside shift reporting. So the title of the project is Benefits of Bedside Shift Reporting on the Number of Falls Utilizing the 4 P's of Hourly Rounding. And those 4 P's are pain, party, possession, and position. So this is my agenda. I will be doing the introduction, the aims and purpose of the project, the methodology, the results, discussion, and then questions answer. So for introduction, I decided to do bedside shift reporting because when I was looking for an implementation project and an implementation site, I called around the Twin Cities where I live to find out what were the needs of some of the hospitals and nursing homes within the area. So at the facility where this bedside shift implementation project took place, one of the needs were the high rate of fall they were experiencing with their residents. So I was told that the facility was experiencing between 25 to 30 resident falls a month. Now, this is a 30-bed transitional care unit, a TCU. So, with the high number of falls amounting to 25 to 30 falls a month, that's very high for a 30-bed TCU. I asked them what were some of the fall prevention methods that they had in place. So I was told one to do hourly rounding, which already exists at the facility, and they periodically check on the residents as well. So I inquire about bedside shift reporting because there have been evidence, there are a lot of evidence out there that show that bedside shift reporting um, helps in anticipating some of the residents' needs or patients' needs that can be addressed to prevent fall. So I asked them about bedside shift reporting, and I was told that they do not have a structured form of reporting end of shift report. So I asked, how do nurses conduct end of shift report? They said, well, end of shift report was conducted anywhere at the nurses station, in the hallway, by the residence room, wherever was convenient for the resident. So I decided to um, implement the bedside shift report. So I talked to the facilities DON, and I also met with their quality counsel and introduced my topic, my prospective topic, and they were in agreement with it and told me it was okay to go ahead and implement the the project. Now, bedside shift report does not only end at the bedside. The purpose is that the purpose of this bedside shift report is that nurses can go into the residence room during the change of shift. They can interact with their residents. They can visualize the residence environment, and then they can also inquire information from the residents on what their immediate needs are. So bedside shift report incorporating the 4 P's, I decided to incorporate the 4 P's of hourly rounding because the facility already has that in place. So I use that and incorporate it into the bedside shift report so that with every encounter that nurses have with the resident, they were asking about the resident pain, they were asking about the resident's possession, whether it's in reach. They were asking whether the resident needed to be repositioned, and they would ask the resident about pain management. Now, you might say, how does that translate into preventing fall during a shift? So this is the very reason why. So that when nurses go to the room, when they engage the resident, they're able to address some of the residents' immediate needs. So during the bedside shift report, a nurse would ask the resident about their pain and their pain level and whatever pain management that was to be implemented. This information is taken during the bedside shift report. However, it goes throughout the shift because nurses are able to anticipate that, okay, this resident told me in room 205 that they needed pain management. I'm going to make sure I address that right after report. Or this resident needs to go to the bathroom, or they need repositioning while we are in the room. Both nurses can assist with the repositioning process, or they can designate their nursing assistants to come and assist the resident right away. So falls in older adults who are age 65 and above are a safety concern in long-term or transitional care facilities. And the reason is that older adults who are over the age of 65 who experience fall sometimes have consequences like broken bones, pelvic or hip fracture or dislocation, head injury, and many other adverse effects that comes along with having a fall. So the Center for Disease Control and Prevention, the CDC, estimates that 1 out of 4 older adults over the age of 65 fall each year. Now, 1 out of 5 falls cause injuries such as broken bones or head injury. The CDC also estimates that approximately 800,000 patients are hospitalized yearly related to fall. Now, we need to be doing more to assist these residents who are age 65 and over to prevent fall. How do we do this? We do this by implementing evidence-based projects such as nursing bedside shift report. Nursing bedside shift report, as I stated earlier, anticipate needs of the residents and promptly address them. Falls are high in nursing homes and transitional care unit, and some of those falls are related to something as simple as taking the resident to the bathroom, repositioning them, putting their communication access within their reach. For example, the resident needs their call light. Maybe the resident wants to go to the bathroom. They have no means of communication. They have no means of communicating with staff if their call light is either laying on the floor or their call light is laying somewhere where they can't reach. Now, in an attempt to get that call light, that could lead to fall. But when nurses do bedside shift reporting, they are able to visualize the patient and visualize the environment within the patient's reach, where the patients or the residents are. They're able to visualize that and they're able to take some corrective measures, such as placing the call light within the resident's reach, such as making sure there are no loose wirings on the floor, ensuring that there are no spills. If there's spills on the floor, the nurses need to go in there and wipe the floor or ask the properly assigned staff to wipe out the whatever, fall hazard that's on the floor. So bedside shift reporting addresses some of these simple problems, and it does not end just at the bedside. Like I stated earlier, these informations are taken and then the nurse is able to adequately plan his or her shift because they already have information from the residents. Involving the residents and their family into the end of shift report serves both positive for the nurse and the residents because then the residents are able to inquire from nurses, when the nurse is going to be back, what pain management they want, what is the plan for the pain management. So bedside shift report help to address some of these simple things that lead to fall in long-term care and transitional care units. So the purpose and aim of this project was fall reduction. This is a 30-bed transitional care unit that was experiencing between 25 to 30 falls per month. Averaging that will amount to about 300 residents for a year. Now that's very, very high. With the implementation of bedside shift report, the aim was to reduce that number of falls, utilizing the 4 P's of hourly rounding, which are the pain, party, position. Proximity is just possession, ensuring that the residents have their immediate needs like their call light, their glasses, their water, frequently used items within their reach so that they don't try to get up to go and maybe trying to reach for their water bottle or their water jug, or trying to get the call light, or trying to reposition themselves, and in that process they fall. So the methodology and design, this was a quantitative exploratory design using a retrospective chart review. Now there was a chart revision of pre and post implementation fall data, which is stored within the facility metrics care for incident reporting system. The facility records all its incidents of fall within the metric care system. So a pre and post implementation data collection was done. Data was collected between March and May for pre-implementation, and then between June and August for the implementation process. The inclusion criteria was every resident that was admitted to the transitional care unit who were aged 65 and above and who have fallen. The exclusion criteria was residents who were below the age of 65 or who were above the age of 65. Now, before the project was implemented, I met with the facility's director of nursing, the educational personnel, the TCU manager, so that I could arrange and coordinate a date and time to present an educational intervention, just explaining bedside shift reporting and teaching nurses how the process was supposed to be done and that is done effectively. So the tools that were used for this project are the Agency for Healthcare Research and Quality bedside shift report implementation handbook. I used the tools 2 and 3. The tool 2 has like a checklist. I use that along with the bedside shift report book itself. So what I did, I used those two in addition to the Healthcare Quality and Innovation Network purposeful rounding tool. That's the 4 P's of hourly rounding. And a data collection sheet was created specifically for this project so that resident information could be de-identified. There was no breach of resident information because every fall incident reporting data that was collected from the facility's metrics care system was de-identified and placed on the data collection sheet. Now, the bedside shift report checklist guide was just a further breakdown of information that I took from the AHRQ and the HQIN tools to make a quick checklist to enhance the bedside shift reporting, because when I did the educational section with the nurses, one of the questions and their main concern about why they were not doing bedside shift report was because of time. So in order to address the time constraint, I decided to just do a quick checklist of items that I took from the handbook and from the full piece of hourly rounding. So that checklist included items that nurses needed to check off while they were in a room to speed up the process of the bedside shift report. So that really helped because they had the checklist. They did not have to take along with them all those big books that had the implementation tools. For methodology, data analysis was done using descriptive statistics, inferential statistics, a sample t-test, and a bar column graph was used to show the trend in falls. A statistician was consulted, so the data was analyzed by a statistician. The implementation phase ran between June 27 to August 8 of 2022. And what were the results? The results definitely show a decrease in falls and fall rate. So there was a total of, I'll backtrack for a second. So the results show a decrease of falls and fall rate. There was a total of 36 falls pre and post implementation. 24 of those falls occurred pre-implementation phase, which shows like 71% versus 12 falls that occurred during the implementation and post-implementation phase, which accounts for about 35.2%. So the descriptive statistic, the data when analyzed, show that fall rate decreased. So pre-implementation phase, there was a mean of 0.74 falls per resident pre-implementation. Compare that to 0.26 resident fall post-implementation. So the data shows that bedside shift report was an effective implementation tool in reducing fall at this facility. So to discuss, fall prevention has to be looked at from a broader and more robust point of view. Nursing facilities have to come up with implementation strategies and implementation plans that will help to reduce falls within their facility. One of such implementation evidence-based practice is bedside shift report, because as seen on the previous slide, you can see that when bedside shift reporting was conducted, there was a decrease in falls and fall rate. Of course, falls have unwanted consequences. As we stated previously, some of these consequences from fall are like broken bones, dislocated pelvis, head injuries. So a more robust and sustainable intervention is needed when the residents' needs are anticipated, whereby nurses go in, interact with the resident, ask the resident what they need, what their needs are, what the immediate needs are. It helps to decrease the number of falls that occur within nursing facilities. Bedside shift report is a more structured approach because nurses go into the bedroom, they visualize the patient, they interact with the patients, they anticipate the patient needs, and they're able to address those needs, if not immediately, but they're able to address it because they are aware that their residents need attention, they need something. And so if they are not able to implement that during the bedside shift report, they have information and they can designate the appropriate staff to do it. As I stated earlier, the end of shift bedside reporting does not just end at the bedside. The nurses take that information that they gather from the bedside and focus on residents who are considered high risk for fall. So during the bedside shift report, if the nurses see that this resident is frequently trying to get a bed, or they met the resident in a position during the report that is likely to lead to fall, they are aware which residents to focus on during their shift. Now, to summarize, this bedside shift report implementation project was conducted at Benedictine Living. It's a long-term care facility located within the Midwest of the United States. This nursing facility houses both long-term and transitional care residents. The scholarly project was conducted on the 30-bed transitional care unit. Now falls on the TCU were a concern to this facility because they were experiencing the high number of 25 to 30 falls when the inquiry was done for this project. So the research hypothesis was to see if implementing nursing bedside shift report incorporating the full piece of hourly rounding would decrease the fall and fall rate at that transitional care unit. So there is no current structural end of shift report. The project title was benefits. The project's title is benefits of bedside shift reporting on the number of falls utilizing the full piece of hourly rounding, which are pain, party, position, and possession. So the concept of the bedside shift report was that nurses conduct a report at the resident's bedside to involve the resident in their care process while anticipating and addressing frequently requested needs such as pain management, toilet use, repositioning, and frequently used items within the resident's reach. So the nurses were to go in, visualize their residents, and address those immediate needs. The goal was to use the information gathered during the shift report to effectively plan the rest of the shift, focusing on residents who were considered at full risk. So this was again a quantitative exploratory design using a retrospective chart review of pre and post implementation for data, which were gathered from the facility's metrics care for incident reporting system. So overall, the data showed there was a decrease in falls and fall rate post implementation of bedside shift report, because prior to bedside shift report, there was a total of 24 falls between March and May of 2022. However, when the bedside shift report was implemented, you can see that there was a decrease in fall because there was only 12 fall that occurred, which amount to like 35.2% post-implementation process. So the data does show that implementation of bedside shift reporting does reduce the number of falls at a transitional care unit. So this was my presentation, and there needs to be a lasting, sustainable approach. So bedside shift report can be tweaked, it can be enhanced, but it does show that implementing bedside shift report helps to reduce falls on transitional care unit. So thank you very much. This is my presentation. Thank you for listening. Thank you for participating. Here are my references. And I hope this project serves as information that can be passed along so that bedside shift reporting can be incorporated into nursing end of shift report at transitional and long-term care facilities. Thank you very much.